recognizing it's a really busy day. I want to thank everybody for being here. I know there's a lot going on, and you took time out of your afternoon to be here to learn a little bit more about early childhood. So to get us going, my name is Sarah Rittling. I'm fortunate to serve as the Executive Director of the First 5 Years Fund, or FFYF, where we work to ensure all children from birth to age 5 have equal access to affordable, high-quality care and education that supports healthy development and helps them achieve their full potential in school and life. We all know the rationale behind this mission, whether it's our shared understanding about the role high-quality early childhood education plays in laying the foundation for school readiness, improving education outcomes and graduation rates, or the fact that the cost of high-quality care is rapidly outpacing most other family expenses working families have. Congressional support for the federal programs that directly invest in more children are essential. In recent years, Congress, you all, have passed historic funding increases for critical early learning and care programs, including Head Start and Early Head Start, Childcare Partnerships, Preschool Development Grants, and the Childcare Development Block Grant. Today, we will be discussing these key early learning and care programs, their funding streams, what each of these programs means for the children and families in your districts, and opportunities for congressional action in the coming year. We're also going to answer any questions you might have, so think about that as you hear. It's important to note at the outset, though, that each of these programs share broad bipartisan support, which is showcased by the commitment of our congressional partners in the Congressional Pre-K Caucus, who are hosting this event today, including co-chairs Congressman Joaquin Castro, Congresswoman Catherine Clark, Congressman Cole, and Congressman Rodney Davis. Unfortunately, due to other commitments, including that little appropriations committee that's happening relating to early care and early learning and care, our co-chairs are unable to join us, but thanks to their staff who are here. Before we launch into our panel, which is going to be way more exciting than me, we're going to take a minute to show you a short video that's hot off the presses. So I'm going to turn to the screen. Maybe? Maybe not? Okay, while we're figuring that out, if it starts playing, we'll stop talking, but I will introduce our panel briefly, and then we'll turn to the panel, and then I'm gonna do some questions, and then you're gonna do some questions. To my far right is Rhian Allvin, who's going to discuss the Childcare and Development Block Grant. Rhian serves as the Chief Executive Officer of the National Association for the Education of Young Children, which is the largest national professional association for early childhood educators, which promote high-quality early learning for all children by connecting practice, policy, and research. Next to Rhian, we have Tommy Sheridan, who's with us today to highlight the Head Start program. Tommy serves as the Deputy Director of the National Head Start Association, where he advocates for policy changes that ensure all at-risk children have access to the Head Start model of support for the whole child, family, and community. Next to Tommy is Kristin Bernhard, who will be addressing the newest early childhood program, the one I call the small but mighty one, the Preschool Development Grants. Kristin serves as the Senior Vice President of Advocacy and Policy at the Ounce Prevention Fund. Her work allows the Ounce to work toward their mission that all children living in America, particularly those born into poverty, have quality early childhood experiences in the first 5 years of life. Everyone's bios, all of which are very impressive, are in your folder if you want to know more about either those on the panel or their organizations, which you all should reach out to as a resource as well. Okay, we're going to go to the video, and then I'm going to turn it to Rhian.
You want some milk? You want some cereal?
Childcare is not a luxury for American families. It's a necessity. Yet the cost of high-quality childcare today is greater than many other expenses parents face. And for families living in poverty, affording quality care is often completely out of reach. Access to childcare is necessary for parents to work or attend school. And for single parents or families that rely on two incomes to get by, reliable, affordable childcare is critical to their job stability and overall economic security. Quality childcare also allows children to develop the social, emotional, and academic skills they need for a healthy and productive future. All parents want what's best for their children, Yet too many families can't afford to pay what it costs to provide the care they need. Thankfully, the Childcare and Development Block Grant Program gives low-income families a chance to support their children's healthy development while they work or attend school. CCDBG is a federal program that provides funding to states to use with their own childcare support programs for low-income families. Today, states have the flexibility to use a combination of state and federal funds to implement high-quality childcare systems that work best for the families they serve. CCDBG serves nearly 850,000 low-income working families across the country each month. And a recent historic funding increase will go a long way toward ensuring states and providers are able to implement the important quality improvements Congress made in 2014. Unfortunately, only 1 in 6 children who are eligible for federal child care support actually receives it. Too many parents across the country are forced to settle for lower quality care or leave the workforce altogether, a decision that can jeopardize their family's financial security. And the talented teachers and childcare professionals who are caring for America's children can barely get by on the low wages they earn. We must do more to lift up children and working parents by ensuring the CCDBG program reaches more families in need across the country. So, let's keep America working by investing in quality childcare for America's working families. By strengthening CCDBG, we're creating opportunities for more children to learn and grow. And we're giving parents a chance to pursue a brighter future for themselves and their family. America works with quality childcare. Ask Congress to support the Childcare and Development Block Grant Program.
Well, good afternoon. It's terrific to be with all of you, and we appreciate your time and attention in helping us to look at the value of high-quality early learning. My job this morning is to talk a little bit more about the Childcare and Development Block Grant, just briefly its history, and how important the most recent investments have been for states, for children, and for families. The original Childcare and Development Block Grant Program, I'll just start referring to it as CCDBG, was enacted in 1990, and you have to think about how critical that moment was in time. It was similar to what we're going through right now in terms of a public awakening to how important access to early learning was. It was the same time that the military was really awakening to how important it was for military families to access high quality care. There'd been some really tragic incidents in military on bases. And so the military was going through this dramatic transformation. And at the same time, there was great discussion about making sure that we use this as a tool to leverage access into the workforce. NAEYC, the organization for which I work right now, had just launched its accreditation. And so there was a huge public discussion about the value of quality as well. So we accredit the Department of Defense, we accredit community-based programs across the country. The implementation was based on this notion of keeping kids safe while their parents work, and a lot of it was driven by the number of women entering the workforce and the kind of the public value of what it means for women who choose to work to be able to have the economic supports to be able to do that. Between 1990 and then in 2014, when the reauthorization occurred, and which was a substantial reauthorization, and I'll talk about that in a minute, we have gotten really critical science, neuroscience, about the value of early learning. We know now that the most rapid period of brain development is in the first 5 years of life. We know that if done right, it creates a level playing field so that kids enter kindergarten with the same background knowledge, with similar language skills. They're able to be really great learners because they've had access to these programs. And the science is hard neuroscience. It's irrefutable neuroscience that really says you do this right, there are all these benefits to the child child herself, to the family, and to our economy as a whole. And so when it was reauthorized, and as we talk about the Childcare Development Block Grant now, it is still absolutely to keep kids safe while their parents work and provide that economic stability. It has a dual role in ensuring that kids are in quality experiences, because that's the only way you're going to get the payoff or the return on investment that economists talk about. So in 2014, the CCDBG was reauthorized, and there were new requirements that were put into CCDBG around the health and safety of kids, and what I would say to raise the floor of what quality looks like. And so states have been busy these last 5 years, 6 years now, I guess, implementing those requirements. All of the CCDBG money is administered, as I'm sure you know, through the Department of Health and Human Services. In terms of funding, it has largely been flat. I mean, it is maybe some really modest increases over time. There was a spike when ARA was in effect in the late 2009, 2008, 2009. And then until 2 years ago, when there was a significant 40% increase in the Child Care and Development Block Grant, which I will say two things. One is we can anecdotally and from some data we have see the positive effects of that increase. At the same time, it is really early in the implementation of that, and so we're busily trying to gather as much information as we can. We know that the money is being used for a variety of things in states. First, to serve more families, to serve more children and families. Two, some states are using it to expand eligibility. So states can decide within parameters their eligibility, and some states are increasing eligibility, so more families fall into being able to access the CCDBG. And then we know it's also being used to increase what the subsidy reimbursement is for providers. And I want to focus on that for a minute, because all of those investments are really important. The financing of early care and education is really complicated. And the economics of early childhood education, the supply and demand of early childhood education don't match if left to its own devices. And we have for forever, many of you probably know this, but the way the block grant works is that states reimburse providers that are willing to serve children who are on subsidy based on a formula and a calculation on what parents who are paying the full cost of care at the current moment are paying. And when you see how dramatically behind states are in paying what the cost of care is, it is the shaky foundation on which we've built the financing of early learning. So we say that quality really matters, the science really matters, it's really important to make sure families have access so they can go to work if they want to. And yet, if the cost of care is $10,000 in 2019, many states are paying at 2001, part of the 2001 rates. So there is a dramatic gap in what providers are getting. And so again, the economics don't work. We just had our day on the Hill with 400 early childhood educators, and I was visiting with the Kentucky delegation, and there was a small business owner. She runs childcare in rural Kentucky, in western rural Kentucky, and she draws no salary. She serves 120 kids. I think she's got 20 teachers. And because of she's NAEYC accredited, it's an extraordinary program, the financing of the business model doesn't work that she can take a salary. So her husband, fortunately, has a well-paying job, so he supports their family, and she runs her business out of the goodness of her heart, in essence, and because of her commitment to early learning. Like, how many business owners do that? And she isn't able to pay her staff health care or afford health care for them. And so we have got to fix the economics. So I just want to close with saying that as we look for exciting things that are happening and opportunities to move the needle forward, There are four payers in this system, right? There are families who are still paying the bulk of it. There's public financing, which is mostly federal. Most money for early childhood comes at the federal level. And then early childhood educators are paying for this system by suppressed wages. 46% of early childhood educators are qualify for public assistance. The average wage is $10.72 an hour. And then the fourth payer are employers. More and more employers are seeing the value of offering benefits around early care and education for their employees. And so as I think about opportunities on the horizon and what's so exciting about the investment that Congress has made, one is to make sure that states are fully drawing down the money that is available to them. That is a super important piece. Two is that states are urged to put in match. There's nothing precluding states from adding money to the Childcare Development Block Grant that Congress has authorized. Three is really accelerating public-private partnerships with employers. There's tax strategies that you can use to do that, but really incentivizing large and small employers to, I always say this isn't your grandma's HR department anymore, like to really think about ways that this is a core HR benefit and that employers are considering that. Four is to pay the actual cost of care. You can't get the return on investment and what we talk about in early learning if you don't actually pay for the cost of care. And to use all of those mechanisms then to drive compensation for early childhood educators so they'll stay in the field and we can make it economically viable for them to stay in the field. I'll just end by saying thank you. We can see early on that this dramatic increase in the Child Care Development Block Grant is having real value for real families in real communities across the country, urban and rural. And so on behalf of the field, we're incredibly grateful.
Thanks, Rhian. Tommy?
Great. Well, first of all, just wanted to say thank you in particular to First 5 Years Fund, Sarah, Amanda, the team for running this. I know these events are always exciting, I think, from our perspective, but even more exciting to see a full room. And so thank you guys for the opportunity. As Sarah had said, my name's Tommy. I am the Deputy Director of National Head Start Association, and I hope everybody has heard of Head Start. Usually you have. I know when I first came to work for NHSA, I came from a state legislature in Minnesota and had known of Head Start as like, oh, that was that program that was across the street from my school when I was a little kid. I had no idea what it did. So I went and visited, talked to my mother, who was a speech clinician in the Minneapolis schools at the time, started learning about it. And as I learned more and more, I was totally blown away that this is really one of our nation's best kept secrets. What we do and the impact that Head Start has, it impacts equity, it impacts poverty, it impacts child development, it impacts health. All of these big comprehensive pieces is really what Head Start was based on. And I think from a broad standpoint, that is really why we've seen such incredible bipartisan support. Folks on both far extremes of the political spectrum, from Freedom Caucus to Progressive Caucus, are huge supporters of Head Start and of early childhood writ large. And I think that that's a testament to the power and as Rhian mentioned, the science that we know about why these programs work and why they are such a critical uses of the federal dollar, especially at a time when we do need to be, and especially this fiscal year, going to be looking at really tight overall budgets. On a broad scale, Head Start is turning 55 this year. We were created in 1965. As part of the broader kind of war on poverty, civil rights era. That whole movement, I guess, was where Head Start came out of it, and was really looked and really expanded substantially around that same time that Rhian had mentioned when Childcare was created under President George H. Bush. And at that time, there was really, as Rhian had mentioned, there was kind of a moment of building and things moving forward. But the creation of Head Start was really based on this idea that child development and poverty is not going to be able to be addressed unless you address the underlying reasons behind poverty, right? Which oftentimes tie into children not having access to education, children not being ready for school when they get to school, children not having access to health, to dental health. Recognizing that you're not going to be successful at school if you're looking at a chalkboard or smartboard or whatever it is these days, and you can't see it. or you're hungry, or you have any of these needs. And so it's really this recognition that you have to have a holistic approach and provide comprehensive services within that to be able to make sure that children are going to be able to be successful. But it doesn't stop there. It also recognizes that you have to have two-generation approaches. So Head Start in particular is we say kind of our secret sauce is really, there's about three main things. Number one is comprehensive services. So the fact that Head Start does provide, or at least connect families to health benefits, to health care, to making sure that there's a medical home, dental care, nutrition services, those types of things. Another area is the as I said, two-generation or multi-generation approach, which we're seeing more and more recently. It's not parents that are raising children; it's grandparents, it's kinship care, it's other folks that are also involved in the system due to just challenges that are facing families today in America. And so we have family service staff that work with parents to set goals, to understand what is your goal? What are you trying to accomplish this year? Is it get a job? Is it get a car so you can get to a job? Is it learn English? Whatever it may be, they work with parents to set their own goals so that parents can then be empowered and be an active participant in their child's education. When kids leave Head Start, we need to make and enter the K-12 system. We need to make sure that mom and dad or grandma or grandpa or whoever the primary caregiver is there to be able to support that child's educational trajectory and educational growth the whole way through. Right? It doesn't stop when you're 5 years old. It doesn't stop when you're 6 years old. It's all the way through, and that's again what kind of the specific piece. The third area that's particularly unique about Head Start, Rhian was talking about the Childcare Development Block Grant, right, which is the federal government sending money to states as a block grant, and then states deciding what they want to do. Head Start's unique in that we do not go through the state. We go directly from federal government to local communities, and that is absolutely essential because what that means is that allows us to have on the local level really a lot of innovation. A lot of interesting things that local communities they're the ones that are tied very concretely to the needs of what's going on with families in that community, of what other services are in that community, of other pieces there. Of ensuring that, again, that this program is developed and maintained with the focus on community need and everything going on that localized level. But then it also makes sure that we have that we're providing the same level of service, at least the bare minimum level of service. There are programs that go way above that, but the bare minimum, which are called the Head Start Program Performance Standards, they're the regulations that oversee Head Start, that everywhere you go, whether you are in Emporia, Kansas, or you're in Emporia, Virginia, or you're in Manhattan, or fun fact, by the way, there literally is a Head Start program in the base of the Grand Canyon. It's a tribal program. It's beautiful and really interesting there. But again, wherever you are, that you're at least getting the same basic level of service through Head Start, no matter what. And if you don't, then you're going to have problems with the federal government and with the accountability systems and oversight and all sorts of things. Again, if you have more questions about that, or if you're hearing of other issues that do pop up in your districts, we're happy to walk you through and explain kind of the whole process and talk about that in much more length. I think that's kind of the overall gist of Head Start from the broad level. I do want to note that when we're talking about where Head Start is offered, as I said, I mentioned a number of different places. If you're wondering if Head Start's in your district, the answer is yes. We are in every single district across the country. We are in all of the territories. We are, we say we kind of cover pretty much every county in America. That doesn't mean that there is a Head Start site in every county, but there are connections to services to be able to provide for kids and families. Head Start has very strict eligibility guidelines, and this is a subject that I know we're going to be looking to you all to work with over the next few years, as Head Start is a little bit overdue for reauthorization, but not that far. HEA and higher ed and a bunch of other ones are way ahead of us on the list. But you have to be meeting under 100% of poverty, federal poverty line or below. Or there's a variety of other types of categorical eligibilities, such as participation in the foster care system. Experiencing homelessness is a big one. And then there's a couple other really nuanced things, like if you are eligible or would be eligible for public assistance, namely TANF, Temporary Assistance for Needy Families, without Head Start, then you could be considered eligible to be in Head Start if that stops you from being eligible for TANF. And then there's a few others, 100 to 130% of poverty. But bottom line is, this is really tight. It's tight eligibility. We are talking about the most vulnerable, the most at risk, and that is why the Head Start model of being run by local communities, of engaging parents, of recognizing that holistic approach, that comprehensive approach is absolutely so critical. So I talked that Head Start is funded from federal to local. That's the way that the grants go, and we are in, as I said, we're in every state. There's also migrant and seasonal Head Start programs that support migrant and seasonal farm working families, and then there's also American Indian Alaska Native Head Start programs, which are federal to tribal partnerships. Again, respecting tribal sovereignty and that connection there. Head Start's funding has been steadily increasing over the last 10 years, 11 years or so. We are currently at about $10.6 billion is where Head Start's funding is, and this is in large part due to the major increase that Congress just appropriated last year. That was a $550 million increase, and it was in one area that I do want to flag here, and then I'll wrap up here. But the funding then goes again from the federal government all the way down to programs. Programs are able to get the increased funds or the resources and then provide additional services. Let's see here. So the two other things, the one thing that I missed, a huge thing that I apologize for. I always talk about Head Start as Head Start. You may have heard of Early Head Start or Early Head Start Childcare Partnerships. I refer to all of those collectively. I think of Head Start as a birth to 5, prenatal to age 5 program. Early Head Start is birth to 3. Services, so infant toddler care is the way to think about it. Head Start is usually 3 to 5. We refer to it as a collective birth to 5. A lot of programs run kind of that whole gamut of operations. And over the last few years, as Head Start has gotten funding increases, there's been the establishment and this really influx of funding into expanding infant toddler care. Because that's the area that we're doing the worst. There is state pre-K that goes on, and that's great, and we're providing a lot of services to 3 and 4-year-olds, but we are not doing a very good job of getting to infants and toddlers. Early Head Start is really the only main program that does that on the federal level that is a direct federal program. And they've established this partnership between Early Head Start and childcare providers, again, locally driven on the local level, that provides additional infant toddler care services. If you have questions on that, I'm happy to return to that. But we did, in this past fiscal year, the reason why I'm raising it is this past fiscal year, we did receive $100 million of increased funds for specifically Early Head Start expansion, which includes the Early Head Start childcare partnerships. And we're really excited to see those funds come out the door. The other big area that we got funding this year was in quality improvement funding. And specifically, that quality improvement funding, there was report language that Congress included to talk about trauma-informed care and addressing adverse childhood experiences. One of the biggest things, Rhian touched on workforce. I'd say the 2 biggest issues facing Head Start programs today, workforce absolutely is up there. Workforce maybe 1, 2, and 3, depending on who you talk to. But the other one is challenging behavior in the classroom. And what we hear from folks is that children are really acting out. They're really having a lot of issues and challenges. And when you're talking about children that young, they're not doing it to be jerks. They're not doing it to needle the adults and to give them grief. They're doing it because they've been through these really horrific and traumatic experiences and don't know what to do and how to handle this or how to channel all of that. And so we're really excited to see this $250 million that will go out to all Head Start grantees for them to engage in certain processes. That was in large part where the big chunk, again, $250 million of the $550 increase is going to, and we're really excited to see where that goes. We do think that there's a sizable need still out there, and as you can see, I think in the packets, some of the letters, there's some support and some additional pushes for additional funds in that space. Again, I'm happy to say more if folks want anything in there, but I will go ahead and just wrap up there. I'm sure there's many things I skipped over and missed, but all I can say is just Head Start's pretty great, early childhood's pretty great. Thank you all so much for being here.
Thanks, Tommy.
Great. Well, thank you, Sarah, for having me here today, and thanks to the other panelists for already providing a really deep and rich overview of some of the early childhood education and early childhood funding streams. So I get to talk a little bit about the baby in the room compared to 55 years old and almost 40 years old now, gosh, of CCDBG and Head Start. And that's the Preschool Development Grant for Birth to 5. So to introduce a new acronym to us, we're talking PDG B-5. Got that? Okay. So PDG B-5 has preschool in the title because it's exciting that it was a part of ESSA, and it was really the first time we were intentionally setting aside funds to say what happens before kindergarten is critically important in determining the success of children when they enter school. And it really recognized first and foremost that what you've just heard is a little confusing, right? There are lots of funding streams that help make up the infrastructure of supports and services for young children and their families. And families don't often know what they qualify for or even what they need in terms of the titles we use to talk about these funding streams. They just know they need some childcare for their 2-year-old in the afternoons while they go to work, or they need some support in the home because they're not really sure how to work with their child on language development and don't know what it's called. The same issue can sometimes happen in states that are receiving the funds from all of these sources or partnering with local entities that receive funds direct from the federal government, and sometimes getting state appropriations to add to the mix. Holy cow, we have so many different acronyms that play in this place. How do we make it all fit together? And the PDG B-5 was an attempt to provide some funding and opportunity to governors to create needs assessments and strategic plans to better knit together all of the funding streams and supports that might be at play in a state around children and families prenatal to 5. The great thing about this is that the response from governors and from territory leaders was overwhelming. In the first round that was awarded in the fall of 2018, there were 47 applicants and 46 states and territories were awarded planning grants for the Preschool Development Grants Birth to 5. That is awesome news when you see that level of uptake and that real ownership of the state level of saying, we're excited about early childhood, but we want to do a better job with what we have, with what we're getting from the federal government, with what we're putting in at the state level, thinking across health and human services and education and home visiting and all of the acronyms to really say what's at play in our state here. The principal requirements for that implementation round of funding were for states to develop a strategic plan and a needs assessment, right? So what do we know about what's working or not working? Who has access to all these different supports and services? Who doesn't? What's creating these barriers to access? Do we even have the data that helps us make better plans so that when we do get large additional appropriations, we know how to quickly deploy that money to the areas that need it most, and we actually have the infrastructure in place to do that? Now, the bad news about the really high demand was that meant there wasn't enough money for it to go around to everyone who wanted it at the levels that they wanted. And in fact, almost all of the applicants had to significantly trim down what they had proposed initially, and most were only funded at about 70% of what they applied for. What's good is that many of them are wrapping up those two key requirements, that needs assessment and the strategic plan for their state now, so they were still able to accomplish a lot of good work. But I'm always interested in kind of what was left on the chopping block. What did states really want to get done that they thought was critical for their area and for their children that they weren't able to accomplish because they had to reduce the project plans of what they were funded for? So 46 states and territories doing this deep planning work to really think about the infrastructure supports needed to administer high-quality early childhood systems. The good news is that last year, December of 2019, we had the opportunity for states and territories to apply for implementation funding. And this was a 3-year grant that would actually allow them to put into place some of the things identified in those needs assessments and strategic plans. And guess what? Out of those 46 states and territories that were awarded, every single one of them applied. Again, this is really critical because this grant is one that is given to the governors, and the governors dedicate the state agency leader in their state who will administer it. So this to me really shows, again, the high level of gubernatorial buy-in for this type of work and this type of infrastructure funding that the federal government can provide. And again, the momentum towards thinking in this way. Again, though, a demand outstripped supply. So out of the 46 applicants, only 20 were awarded funding to actually implement what was identified in their planning year that their state needed for early childhood. Again, the beauty of this funding is it was thinking about how do we pull together all of these pieces that are coming into play in our state to also make it easier for families to know what they might qualify for, to find the services they need, and to increase access to those services regardless of which type they are. 6 new states were also awarded those planning grants that didn't get it in the first go round. So right now we have 26 states and territories that are working on PDG B-5 work. So you might be thinking, though, it's not as exciting to some degree as this idea of providing families who desperately need childcare so they can go to work, like a slot, a place where they can leave their child that's safe and healthy so they can go to work. We're talking about things like data systems and strategic planning and needs assessments. I can't bring a parent to the stage who necessarily has been helped by the fact that a state agency leader who runs the childcare subsidy system can now pull a beautiful report that shows where childcare deserts in their community live. But I think you all know, especially as people working on the policy end, how critical that type of data is to make good use of these types of investments. And so in thinking about PDG B-5 funding and why it's important and why we should continue to think about infrastructure and systems building funding is that, again, we need to be thinking about how do we knit together all of the funding streams that are available for young children and their families give states and those implementing work the data they need to make those systems stronger. And I would offer, too, this is a place where I think federal investments are really uniquely poised to deliver something. These are relatively small investments. We're talking under $10 million per state in most cases compared to some of the larger appropriations. But the impact these have are like levers, right? These grants give states the information they need to make the decisions about the larger funding streams and to be smarter about those investments. And so as we think about opportunities to continue to grow federal investments in state and territory early learning systems, opportunities like PDG B-5 are really critical to think about how we get the data, the information, and the infrastructure we need to do this really well in our country. With that, I will turn it back over to Sarah.
Great, beautiful. Thank you, everybody, for that. I wouldn't call it an overview. It was like the overview plus, which I think is really beneficial. So great, thank you. I have questions, but I don't want to hog the floor. If other people have really burning questions after that they want to ask, or I can do mine. So I'm going to defer to those of you in the room who might have something really top of mind they want to ask, or I can turn to mine. Yeah.
Yeah, I guess I'd like to talk about childcare deserts
Yeah.
in rural areas. What are some implementation issues and solutions from your organizations, from whether it be Head Start or the grant itself or
Yeah.
implementation? What are you doing to kind of close those deserts, and what else can we do?
Absolutely. I'll just share that I think a huge opportunity, especially in rural areas with childcare deserts, is thinking about the supports we provide for family childcare. This is maybe a person in the community who cares for children in their own home. But oftentimes those are actually licensed by the state. They're held to the same health and safety standards or to health and safety standards and can still benefit from the same types of quality improvements that we might think of in a more traditional child care center. That person who's caring for children in their home could still benefit from support on understanding child development, thinking about how they build the social emotional skills of the children in their care, and even running their business model. Even if you're only caring for 4 or 5 children, there's still a business model at play there that family child care providers need to be aware of. So I think we're excited about things like the Early Head Start Child Care Partnership grants that really think about working with family child care in different ways. States that are using CCDBG dollars to think about family child care networks. The economies of scale are a little bit different in family child care. Again, it's a much smaller setting, and they might be spread out in a large way in rural communities. And so thinking about how states use quality improvement dollars to bring resources to a network of family child care providers and grow that, I think is a really interesting way to approach the rural childcare desert issue.
I agree completely. I think family childcare is essential in rural communities, and we need to be paying attention to the fact that family childcare has decreased dramatically over 30% or something in the last few years. Like, it's really dramatic, and so making sure that we're treating, from a systems perspective, treating family childcare as a viable and core piece of the model, which means the financing, it means how we're thinking about it related to quality rating systems. And so family childcare is essential. Second thing I would say is, I'm going to sound like a broken record, but I am seeing more and more examples where employers are using childcare and having childcare on their campus as a recruiting tool in rural communities. It's often the case that in rural communities there's one big anchor employer that funds a workforce, that fuels a workforce, and so and the U.S. Chamber of Commerce has great information about this. There are more and more employers that are saying in rural communities, to attract the workforce, maybe it's factories, whatever, to attract the workforce, we need to actually have skin in the game related to childcare. And then I'll put a plug in. I'm not here to talk about Head Start, but I will put a plug in for Head Start. I'm from Arizona, and in the very, very ruralist of communities in Arizona, I saw Head Start chapter houses in tribal communities. Head Start has a few decades under their belt on doing this well. And so, at least from my perspective in Arizona, I saw great models of Head Start able to reach in really rural communities in partnerships with school districts and that sort of thing. I didn't mean to
And you actually, the question raises a couple of other things, I think, that come to mind. One, which certainly came out of Kristin's comments, and it was a through line, I think, throughout all of this, and is that the federal government, and we're here today because it's appropriation season, but the federal government is a foundational partner. Rhian pressed on this, everyone pressed on this, to states, but also to communities, And so what we are doing here, what you all are doing here, is very much tied and connected back. We're not the sole operator, we're the biggest operator, and therefore the opportunity to be the biggest instigator toward moving further faster. And certainly the preschool development grants are an example of how we might be able to do that. But there are governors and mayors and chambers all over this country who are grappling with this issue and being partnered up and trying to address this. And what we're seeing is, like I said, I think we are obviously in the middle of appropriation season, want to make sure we get that. But the number of bills that have been introduced by you or your colleagues that address some of these issues like the desert and some other issues around workforce or apprenticeships or what have you are really starting to generate some conversation on outside of funding or in addition to funding that help also address some of these issues in the desert is certainly an example of that. So I want to, thinking through a little bit of that. Yeah, go.
I was just going to add, I literally saw a report yesterday about this, even though you may not think about New Jersey as having childcare deserts. There was a report that came out that studied New Jersey, and I'm literally pulling from it. I pulled it up right here while we're talking. Just to make Rhian's point about Head Start even more strongly, that Head Start played a significant role in reducing a severe supply gap of center-based childcare in New Jersey. Head Start availability was related to 84% reduced odds of having a severe childcare supply gap in the state of New Jersey. And that's, again, in a relatively urban state, right, that has a lot of, not too far there. I do think that, the fact that Head Start is community-based allows us to focus. I know this when I was in the Minnesota State Legislature, one of the big issues that we were always focusing on is the Twin Cities versus the rest of the state, right? And how are funds getting out there and going out there and being spent? In this space, one of the big things that Head Start has done is focused in on county, on need, on rural communities in particular to ensure that that's where that goes. Keep in mind, childcare deserts are not just in rural communities, but we see that most profoundly in that space. And again, I think a strong partnership of all of these programs does a really good job to ensure that through PDGs, we can do the appropriate planning. Through Head Start, we can provide additional services and access, and then through childcare as well, providing some additional supports dependent, because childcare follows kind of where families are, where children are, versus necessarily at the center level. But I think that there's a big opportunity to do even more on this front. And I would just say the other thing is that these quality dollars that we're talking about, we made a small step with the increase last year. I hear from programs all the time, especially in rural communities, we could use so much more for transportation. Because a lot of times when you are trying to provide services, the biggest barrier is transportation of a child to a program. And in the 2000s and late 90s, Head Start really did face some tight financial times. That was the first thing that was cut. And we haven't added that back in. So I do think that quality improvement funds, which will allow each individual community to decide this is what I need versus what may be needed down the street or down across the state or whatever, are absolutely critical. But again, I think to your point, investments in all three of these programs will make significant impact on childcare deserts. Again, access and affordability and all those other questions still remain. But I appreciate the question.
Yeah.
Without being duplicative and recognizing the overlap, can you talk a little bit in that vein about what can be done about urban childcare deserts and if there are any alternative or any differences in approach there?
The biggest thing I would just say, and then I'll turn it over to let others jump in. I think additional opportunity, additional funding, additional support for local community programs to make that decision. One of the challenges in urban programs is gentrification, right? And changes in communities. And as communities change, how are we making sure that Head Start programs, that childcare programs, that other things are moving along with those families? And that is a difficult, tricky thing to do. That's where some of the planning supports that come in. That's where some of the other pieces. But additional resources to provide expansion is a big area where that's huge. I talk a lot about quality improvement. I talk a lot about trauma-informed care, but knowing if there is opportunity at the end of the day, given tight budgets, this is a matter of priorities, though. So that's why you guys are paid the big bucks, right? But the making a priority of investing in expansion, of looking at expanding infant toddler care, of looking at expanding planning grants, things like that is so critical. It will depend on the community, and it will depend on the availability of funds to move some of those facilities and programs and follow the families rather than where the centers have been traditionally located.
I would also add, it goes back to the financing of early learning. There are not many Jennifers in the country who are willing to not draw a salary and run childcare. And so we've got to figure out the economics so that it's a viable market, quite frankly. I mean, it's like any other industry where if you're going to entice the industry into an area, high tech, whatever, you have to make it economically viable. And I think going back to who the payers are and how you share, it is expensive to run childcare because of a couple things that won't change. You can't have 25 babies in a room with one person. Like, I don't know how many of you have been with babies, but I would last about a day and a half doing that. I love my kids. I love my kids, but so it's not like there's some secret sauce that will fundamentally change the economics of childcare. You have to, it's an expensive proposition to run, and that's not going to change. And so to figure out then how you either get more payers in the system or be more aggressive in sharing the burden for the payers. So for example, one model I just saw recently is a model where a private provider came in. The city, it was an enterprise zone. They used to call them enterprise zones. I don't know if they're still called opportunity zones. Yeah. So the city almost gave the parcel. I think there was a small lease on it it was like a small long-term lease. But the city basically said, here, we'll give you this infrastructure. Like, we'll give you this building. You come in and run the childcare. And that's one of the reasons that employer-sponsored childcare is such a viable model, because the cost sharing happens. The typical, in many instances, the employer pays for the furniture, fixtures, and equipment, pays for the cost of the building. And so that piece, then the provider doesn't have to pay for. The provider just has to pay staffing and costs of running the childcare. And so I know that some states have looked at tax incentives for employers to be incentivized and for providers to be incentivized. But the nugget is sharing the cost of what it takes to just the annual operating budget of childcare. And I do think there are innovations that municipalities, counties could look at, even institutions of higher education. As you know, think about how many associate degree programs are in places where maybe other storefronts, where other organizations aren't. You know, would they be willing to share the burden and the cost a little bit? So we have to get at the economics of childcare to relieve the desert issue.
Yeah, no, I think you should talk.
I just want to throw in one piece that is the idea too that our data systems need to be a lot more nuanced to be able to answer that question. So I live in Chicago, right? In River North, so the heart of downtown, if you can think of that. And if you told me that I needed an infant slot, but it was in the far north suburbs, that wouldn't really do me much good, right? It might still be Chicago address, but that's not going to help me understand my need. And the other addition of the fact of that childcare access and childcare deserts are so dependent too in thinking about the age of the children. So in Chicago right now, we have neighborhoods where there's actually, you might even say, oversaturation of pre-K slots. But if you need an infant toddler slot, you better have gotten on a waiting list 2 years ago. So the concept of desert for who, for where, for what, and what those needs are so nuanced, and we don't have an easy way to pull the data that gives us the information to know that, like, the desert we really face in my neighborhood is an infant toddler desert, which would require really differentiated strategies. It could be workforce preparation strategies. It could be physical building capacity strategies. It could be tax incentive strategies. Then a pre-K issue, which exists in other neighborhoods. And so our ability to, again, think about investments in foundational infrastructure like data systems that help us better be able to pinpoint those issues and find the appropriate strategy to combat them, I think are really critical.
I'm going to add one thing, and we don't necessarily typically around here to look at DC, but in this instance, it's actually a really interesting case study in thinking about some of this. And of course, I think the beauty of early childhood is it very much is unique to states and communities, and very much driven by parent choice and what's best for your family. But the fact is that in Washington, D.C., if you choose to, you can go to preschool. You don't choose to. If your parents choose to, you go to preschool for when you're 3 and 4 years old. And so now the city, that's been widely successful, I would argue. I benefited from it as a parent. I should say my children benefited from it. anyway, the fact is now the city is really, and the philanthropic community in Washington, D.C. is doing a really hard look at what that means for infants and toddlers and what their needs are. It's very similar to what Kristin is saying. So, I mean, we're happy to follow up on some of that. Again, it's a case study in D.C., but it is, it's right here. And they're in the middle of it and really grappling with it. What does it mean for new construction and taxes and all that kind of stuff? Yeah. I don't see who's saying. Yeah.
So based on these programs and grants, how can we see the allocation within the state? Because as you mentioned, oftentimes the issue within the states that the biggest city gets all most of it, and everything outside gets the scraps. So how can one say which districts or counties get what allocation of money?
Which state are you in?
New York.
You're in New York. We can follow up with some more information, but many states now have integrated early childhood data systems. You might see the acronym ECIDS pop up in your state. And that's one place where states are trying to do a better job of being more transparent about where services were delivered in the past. It's really a research and data mining tool for states, but it looks kind of across a lot of these programs and lets you see like which counties received how many slots, what were the ages, what's the race and ethnicity data of the families served. But they're in all different stages all across the country. But that's one thing I would look for in your state. And again, a lot of those were created because of investments from.
And it's on the wish list of things I know for my team in particular at FFYF. We have state level across these programs. But yeah, I mean, we need to get more granular.
And I'll just add, I mean, it's the part of it is also just there's for some reason, I don't know why, but Head Start grants don't align with congressional districts and with counties. So it's I'm being sarcastic in case that wasn't clear. But so it is difficult to track that on the individual level. There's also a fair amount of a lot of the families that are served by these programs are very transient. And so there is movement that they go around. I mean, Head Start, we look at the numbers of Head Start slots versus the numbers of families served by Head Start, total children served by Head Start. And it usually equates to about a 1.25 ratio or so, or 1.5 ratio just over the course of one school year. And that's just how much these families are moving for jobs, for whatever purposes that goes on. But again, I think what was said, if you have specific questions on Head Start, we can track that information down. There's some really good federal resources about individual programs on the Head Start level that I can point you to a Head Start locator on the Office of Head Start's webpage. That's really good resource. And then state specific, I think we all have fact sheets. I know we have Head Start fact sheets, and there's some other broader ones as well that we're happy to check in with you on. It's hard data to keep track of, right? And figuring out. I mean, this is even when we talk about family childcare, right? And thinking about where's licensed family childcare versus family friend or neighbor care, or all these other types of things, and it gets convoluted very quickly. But very good question.
Any other questions? Yeah. Hi.
Kind of on the topic of data, given that 2020 is a census year, I'm curious to know
It's a great question.
if and how the census plays a role in your programs.
Oh my gosh, yeah.
If you all are doing any efforts, and perhaps how some of our offices might be able to support those efforts.
So many efforts, and the census is critically important. Oh my goodness. I think we've actually been really pleased this year to see early childhood nonprofits, programs, advocacy organizations all really mobilize around the importance of the census and helping to create resources and promote resources that help those who are in contact with our youngest be counted and help dispel the rumors and myths that might exist to ensure we get an accurate count. So census is hugely important. I think all of our organizations have a plan in a variety of ways to help push resources. At the Ounce on the advocacy side, we're sharing out everything that comes our way about the different resources being created around census awareness. We also do direct service in home visiting, Head Start, Early Head Start, Childcare in Illinois and in Washington State, and are sending out those resources directly to the families that we work with to, again, help dispel the myths and rumors. But just critically important, and happy to help share anything that your offices have created to help get that out as well.
Go ahead.
I was just going to say, just echo that and say that NAEYC is a professional membership association, so we have 60,000 plus members, and so we're really pushing this topic with all of our members who are in childcare centers and that sort of thing to work with families. The second thing I would just mention is Sesame Street just did an awesome video.
Great video.
This got the count. It's hilarious. But if members would tweet out and push out the Sesame Street video. It's lighthearted. It kind of takes the edge off the conversation. It's really well done, and it might be a great kind of social media opportunity for your members.
And I will just add, to the other part of your question. So it's Census does impact Head Start specifically. I don't know about childcare and PDGs as much. I don't think PDGs, but it does. But it's not a direct correlation into the funds that happen every single year. So the way that Census, it's kind of an indirect relationship. So it's not like a Medicaid type program or other things where if the census numbers are low, the state's not going to get as much funds. But it predominantly is used when there's increases in funds. So if we get an increase in funding for Head Start, they would look at census data to see where should those funds generally go out to. But it's not something that impacts every single year's, like every single year's appropriation or the way that funding is allocated and put out into individual programs. But again, the biggest number of, most significant number of undercount is in the birth to 5 space. And that is something that I think all of us are all working on a lot of initiatives. And the more we can do to talk and to let families know that this is important because it helps get additional resources and supports for them. That's the reason why we're talking about it.
Nobody's going to leave. If you have follow-up questions, please do. I will say this, though. It's great that you're here. It's great that we're here to be able to tell.
They can leave, though, right?
That you can. Nobody here is leaving. You may go.
Doors are locked, guys. We're in it.
That's excellent. That's so good. I will say, but going and seeing these things and going and visiting is hugely impactful. It makes this all make a lot more sense. Anybody up here, anybody can help you do that either at home or here in DC. So please consider getting out there and having a little bit of fun and visiting with some kids. So we're happy to help do that. So thank you all for being here. Again, the people up front at this table with the microphone will stay and answer any other questions.
Anybody else is welcome to stay, too.